guys, welcome back to our channel. It's Veronica between two ferns and a candle. Today we're going to be going over the TIMI scores. So I'm going to go ahead and start with the TIMI grade flow. So there's 4 different scores you can have with this. And so this comes into play when you're going into the cath lab and you're taking a look at arteries and seeing the perfusion within those arteries. And so first you have 0, which means that there's no perfusion whatsoever. Then you move down to 1, where there is penetration, but there's no perfusion occurring in the artery. Then you move down to 2, where you have partial perfusion, and then you move down to grade 3, where you have full perfusion of that artery. So pretty easy and simple. I just want to remember that there's a 0 instead of a 1, 2, 3, 4 with that. So now we're going to move over to Shannon, who's going to look over the other TIMI score that we have.
So this TIMI score is a little bit harder. Also, I don't know if this is worth remembering, but if you want, TIMI means thrombolysis in myocardial infarction, so clot in MI. So the TIMI risk score has a scale of 0 to 7. So before we had 0 to 3, this one's 0 to 7, and then 3 plus is considered high risk. So 3 out of 7, you're high risk. So when are we using this? Good question. When we're trying to predict the risk of death or infarct for an NSTEMI or unstable angina. So if you have a patient in the ED and they have an NSTEMI or unstable angina, but you're not really sure, are we going to take them to the cath lab? Are we going to just give them meds? You could do the TIMI risk score, and that can kind of give you a better picture of your patient. So the TIMI risk score can be broken down into history and presentation. So there's 4 things to do with the history and 3 with the presentation. So I'll go through presentation because it's a little bit easier. The 3 things are angina, cardiac markers, specifically troponin, and then ST elevation. I don't know why ST elevation is in there because we're doing this for NSTEMI, unstable angina. So if anyone, comment below if you know that. And then history. There's 4 components to history, so you have to be 65 years and older. Greater than 3 coronary artery disease risk factors. So those risk factors are hypertension, cholesterol, smoker, kind of our general things. So you have to have 3 of those. Another thing is known coronary artery disease. So you've had ischemia or infarct in the past, or you get a lot of chest pain. And then aspirin use in the last 7 days is a point. So you remember that last 7 days because this is on the scale of 7. So if you remember this, that's impressive. I don't know if I will, but I'm gonna try. But mostly I'm just gonna think, okay, there's 3 points with presentation and there's 4 with history, and then 3 plus is high risk. So if you can remember that, that's probably pretty good. Thanks for tuning in.